and he has a pain located in the lumbar sacral area, radiating down the, which leg was
Right side.
the right side.
Yeah, right
So
side.
so when you came to me, give me a little bit of history on what has happened to you and how long it's been going on.
Sure, it's been going on for just about a year. I'm very active, go to a gym, a fitness center with these high intensity workouts. I haven't worked out in 6 months. I haven't been able to really do much at all. The pain's constant, 24/7.
How much sleep would you get at night usually?
Unfortunately, not a lot until I took stuff to help me sleep. I mean, I literally would have to take muscle relaxers or something to allow me to sleep, and I'd get up, I'd sit up in pain.
Yeah, and you never liked the narcotics, so you never took
No,
narcotics?
I'm not the drug person. I would do Tylenol, but nothing really alleviated this pain.
So what was the level of the pain in your
It's
lower?
a 9 out of 10.
Okay.
And it gradually grew. It didn't start as a 9. It started getting worse to the point where I was not doing much.
Did you have any of the surgeons suggest that you needed surgery?
Oh yeah, after my last consult where they did the nerve block and then a diagnostic needle into my spine, after that they said, well, you're a really good candidate for surgery if this doesn't work.
If that was a nerve conduction study?
That was they did the nerve conduction study, and then they said, okay, we need to do another study where we put numbing fluid into your spine.
Got it.
That was the one that was extremely painful. And afterwards they said, you're a really good candidate for surgery.
Okay. So on Monday, you had your first treatment.
Correct.
So tell us what happened after the first treatment.
And I'll start with, I was a bit of a skeptic. Because I've been to so many doctors and nothing alleviated the pain. I thought, no. I had met with you. I had the first treatment. I got off the table. I was able to touch my toes. I think I showed you that. The pain was gone. It went from a 9 to a 2. Within a 4-minute, however long I was even in there, I don't even know. It went from literally from a 9 all the way down to like a 4, 3, 2. The fact that I could stand, touch my toes. This morning I did yoga.
Why don't you stand up and show them what you're...
Yeah.
So before, when you came in, you couldn't touch your toes?
Before I would walk like this.
Okay.
The pain was just debilitating right here.
Right.
I was unable to do this. I could do these touchdowns again. All these things that I was just unable to do. I mean, I could not do that at all. It is gone by 95%, the pain.
And now today, you've had the third treatment as of today.
Treatment, correct.
Right. And of course, it improved so much the first time.
I was a skeptic, and when I left, I think I called every single person I know that has had, lumbar spine issues and referred them in. I know a few have already come in. I am a full believer. I can't believe it worked. Not that I don't believe you, but because I've become a pincushion for the other doctors.
Yeah.
They kept poking and prodding and sticking me, and nothing worked. So this is truly remarkable.
She had serious pain in her left knee, okay, and she also had a replaced right knee. So at the time, we talked about the use of radiation. And tell me, if you could, in your own words, what happened after the first couple treatments.
It was great. All my pain, almost all my pain, was gone from the knee that was looking forward to having to have a replacement. And I tried to do everything not to go through another replacement since I've been through one. And this was great. I now can get up, I can walk, I don't have pain. It's wonderful.
So it was such a good relief that you looked at your right knee,
Right.
which had a replacement, and that had some issues.
Yes, the replacements are not perfect, and they're not going to be like an original knee. And I had robotic surgery, so everything was in line. It was perfect. It was lovely. But I had some residual pains, and it was uncomfortable. And now we're getting treatment on that knee, and it's great. I'm very, very pleased.
So if you started off in the first place with your left knee, what level of pain were you having in the left knee when you first
10.
started? A
It
10.
was a constant pain, getting up, sitting down, and everything, in every aspect of my life.
So your quality of mobility was way down
Way down.
based on that.
Yes.
And what would you put yourself on the left knee now? What's your level of pain now?
1 or half of 1.
And the quality of your mobility and all that?
It's great. I no longer need to use a cane all the time or hold on to someone's arm all the time, where I did have to before.
You can go up and down steps?
I go up and down steps. I still do the old people kind of steps. I do one at a time, and I think it's now habit from having so much pain.
Got it.
But yes, I
Okay.
can go up and down steps. I can do everything.
So on a satisfaction level of 1 to 10, 10 being the highest, you would say on the left leg you are?
The most satisfied at 10.
Okay. And on the level of the, now let's go to the right knee, on the pain level, what was the pain level on the right knee?
The pain level wasn't a lot.
So
But
maybe a 3, 4?
Oh, it was, yeah, about 3, 4.
Okay. And
now-
after treatment with
And
it?
I've only had 2 treatments. I think today maybe was the 3rd, and it's gone down considerably. Maybe 1.
Okay. So you're very
It's still a
satisfied.
little
there.
tender to the touch in the one area.
Okay. So you're very satisfied with that too?
I'm very satisfied with the entire system, treatment. It's a godsend.
And the treatment itself was painless and it
Oh,
took-
absolutely. Quick,
Quick.
fast. Everyone is polite. It's wonderful.
Okay. Thank you very much.
Thank you.
How many things did you try on your knee?
Well, once I tore the meniscus, I did the surgery, and then I forgot what the first shot was that he gave me. It didn't seem to work. And then he tried cortisone twice, and it didn't seem to work. The pain was still there. Now the cortisone seemed to work on my shoulder, but it didn't on my knee. This is the only thing that's really worked on my knee. Nothing
Okay.
else has ever.
And so how long ago did you have your surgery on your knee for the meniscus, torn meniscus?
I don't know, 2014 maybe?
So over
2016.
5 years, 6, 7 years ago. And
Close to
you've
that,
been,
yeah.
since that surgery, you've had that continual pain in that knee.
Yeah, I would limp. I couldn't walk stairs without, bracing myself for each step. I walked slower, and before that, my wife used to have trouble catching up to me every time we would walk somewhere. And then she goes, "I know you're in pain because you can't keep up with me." Now we're back to kind of, when we walk, we can walk together.
She's being evaluated for treatment to her knees, and so she's going to walk up and down, and that's how she walks today. She has a little bit of a foot drop too, but and that's mainly on the left side or right side actually. Well, yeah, okay, and the knee that hurts you the most is which knee? Is
Left.
the left knee.
Yes.
Okay, all right. Wow.
It's good.
And
Very good.
very good.
It's very good.
Very good. All right. Wonderful.
Oh,
Never.
wow. Thank you, doctor.
You're okay. So this is patient who has recently been treated for her knees. She's now walking up and down.
No está inflamado tampoco.
She said it's not swollen either.
It's not, no more fluid?
No.
Okay. And the pain, and she can pick the legs up?
Dolor? Nothing.
Nothing. Now wonderful. And this is the completion of your treatment. You've had 5, right? Or
Five.
5 treatments. Okay, wonderful.